Get ready to master Medicare like a pro with all your burning questions answered in simple terms, comparing Medicare Advantage to Original Medicare. Alright, let's get started. Welcome to our Medicare school session. Today we're diving into the world of Medicare, a lifeline for millions of older adults in the United States. Did you know that Medicare enrollment can be a real maze to navigate? From deciphering the various parts to understanding eligibility criteria, the process is riddled with common questions and confusion. Stick around as we unravel some surprising facts about this crucial healthcare program. Let's break it down. Part A covers hospital stays, Part B handles medical services, Part C combines A, B, and often prescription drugs. It also covers some dental, vision, hearing, and wellness programs. Part D is all about prescription drug coverage. Each part plays a vital role in your healthcare coverage, so let's unravel their intricacies. Let's start with Original Medicare. Original Medicare is the traditional program offered directly by the federal government and consists of Part A and Part B. Part A covers hospital insurance, which includes inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. Most people don't pay a premium for Part A if they or their spouse paid Medicare taxes while working. Part B covers medical insurance, which includes doctor visits, outpatient care, medical supplies, and preventive services. Part B has a standard monthly premium, which can vary based on your income. The standard premium for 2024 is $174.90. The premium can change yearly. Based on the past years, it has increased. One of the key benefits of Original Medicare is its flexibility. You can see any doctor or hospital in the United States that accepts Medicare. What is Medicare Advantage? Now let's discuss Medicare Advantage, also known as Part C. Medicare Advantage plans are offered by private insurance companies approved by Medicare. These plans provide all the benefits of Part A and Part B, and often include additional benefits like prescription drug coverage, which is Part D, vision, dental, hearing, and wellness programs. Many Medicare Advantage plans also offer extra services such as gym memberships. Medicare Advantage HMO, which stands for Health Maintenance Organization, typically requires you to use a network of doctors and hospitals to get the lowest costs. This means less flexibility compared to Original Medicare. Some plans may also require referrals to see specialists or prior authorization for certain services. Medicare Advantage PPO plan, which stands for Preferred Provider Organization, does allow flexibility with provider networks. It allows you to see providers both in and out of network throughout the United States and does not require referrals. Now let's highlight the key differences between Original Medicare and Medicare Advantage to help you make an informed decision. 1. Provider flexibility. Original Medicare allows you to see any doctor or hospital that accepts Medicare anywhere in the United States. This is ideal for those who travel frequently or want the freedom to choose their healthcare providers. Medicare Advantage plans, however, typically require you to use a network of doctors and hospitals. If you go outside the network, you may pay more or the services may not be covered at all. 2. Additional benefits. While Original Medicare covers hospital and medical insurance, it doesn't cover routine vision, dental, or hearing care. Medicare Advantage plans often include these additional benefits, making them a more comprehensive option for some beneficiaries. 3. Costs. With Original Medicare, you pay a monthly premium for Part B and any additional costs like deductibles, co-payments, and co-insurance. There's no out-of-pocket maximum, so your costs can add up. Medicare Advantage plans usually have lower monthly premiums and include an annual out-of-pocket maximum, which can help protect you from high medical expenses. 4. Prescription drug coverage. Original Medicare does not include prescription drug coverage. You'll need to enroll in a separate Part D plan for this. Many Medicare Advantage plans include Part D coverage, simplifying your coverage with one plan. 5. Referrals and authorizations. Original Medicare doesn't require referrals to see specialists. Medicare Advantage plans often require referrals and prior authorizations for certain services, which can add an extra step in managing your care. Choosing between Original Medicare and Medicare Advantage depends on your personal healthcare needs and preferences. If you value flexibility and want to see any doctor or hospital that accepts Medicare, Original Medicare might be the best choice for you. If you prefer additional benefits like vision, dental, and an out-of-pocket maximum, a Medicare Advantage plan could be more suitable. Understanding these differences is crucial to making an informed decision about your healthcare coverage. Medicare Supplement. Insurance, also known as Medigap, is designed to fill the gaps in original Medicare coverage. Medigap policies are sold by private companies and can help pay some of the healthcare costs that original Medicare doesn't cover, like co-payments, co-insurance, and deductibles. Some Medigap policies also cover services that original Medicare doesn't, like medical care when you travel outside the United States. It's important to note that Medigap policies are only available to those enrolled in original Medicare. You can't use Medigap to pay for costs associated with Medicare Advantage plans. So what are some key points to remember when choosing between these options? 1. Enrollment periods. Be aware of the enrollment periods for Medicare. The initial enrollment period is a 7-month window that starts 3 months before you turn 65, includes your birthday month, and ends 3 months after you turn 65. There's also the general enrollment period from January 1st to March 31st each year, and the Medicare Advantage open enrollment period from January 1st to March 31st. 2. Late enrollment penalties. If you don't sign up for Part B or Part D when you're first eligible, you may have to pay a late enrollment penalty. The Part B penalty is 10% for each full 12-month period you could have had Part B but didn't sign up. The Part D penalty is 1% of the national base beneficiary premium for each full month you were eligible but didn't enroll. 3. Special enrollment periods. These are times outside of the usual enrollment periods when you can sign up for Medicare or change your plan. SEPs can be triggered by certain life events like moving, losing other insurance coverage, or qualifying for extra help with Medicare prescription drug costs. 4. Coordination with other insurance. If you have other insurance, such as through an employer, you'll need to understand how it works with Medicare. In some cases, your other insurance may be the primary payer, with Medicare acting as the secondary payer. In some cases, you cannot have employer healthcare coverage and a Medicare Advantage plan or supplement plan. 5. Coverage for specific needs. Consider your specific health needs when choosing a plan. If you have chronic conditions, require frequent medical care, or take prescription drugs, you'll want to choose a plan that covers these needs adequately. 6. Plan changes. Medicare plans can change their coverage and costs each year. It's important to review your plan annually during the open enrollment period, from October 15th to December 7th, to ensure it still meets your needs. 7. Assistance programs. There are programs available to help with Medicare costs if you have limited income and resources. These include Medicaid, the Medicare Savings program, and extra help for prescription drug costs. Understanding Medicare can feel overwhelming, but taking the time to learn about your options and asking questions can help you make the best decision for your health and financial situation. Thanks for joining us for our Medicare School session. Don't forget to subscribe for more informative videos on healthcare. Share your Medicare experiences by contacting me directly or in the comments below. Let's learn from each other and empower our healthcare journey together. See you next time.